No, and there's an important distinction to be made here. Gender incongruence is no longer classified as a mental and behavioral disorder, but rather classified as a condition related to sexual health. This reflects the current knowledge that transgender and gender-diverse identities are not conditions of mental ill health, and that classifying them as such can cause enormous stigma. Mental health assessment prior to treatment is required, but this is not a requirement for psychotherapy or for psychiatric assessment or treatment. The standards of care state that mental health professionals should assess for and address any existing mental health conditions that can interfere with a person's capacity to consent to gender-affirming treatment, or that could interfere with their capacity to participate in essential perioperative care before gender-affirming treatment is initiated. The mental health assessment letter is intended to speak to the patient's experience living with gender incongruence, their overall physical and mental health, the social support systems they have in place, and the ability to participate in their postoperative care. Most importantly, the mental health assessment is not intended to be a barrier to care, but rather exists to encourage, empower, and support all the psychosocial and practical circumstances that may arise throughout transition.
Gender incongruence is no longer regarded as a psychiatric disease in the new definitions. So in many countries, this has led to a lot of changes regarding the rights to get treated. When it's not regarded as a psychiatric disease, it doesn't mean that the people with a gender incongruence do not suffer from anxiety, suicidality, self-harm, or social withdrawal. But all these phenomena can be consequences of the negative pressure from the surrounding society. I think we need to be better at embracing minorities, and studies have shown that treating trans people with hormones and in some cases surgeries is very helpful regarding quality of life. But I don't think that psychiatric evaluation is needed in every case. I think it depends on the individual.